Hello and welcome to Healthcare Leadership in Action, a podcast from the Faculty of Medical Leadership and Management. This podcast is about equipping you with the knowledge and skills you need to become a better leader in your health system. My name is Jamie Smyth, and I'm a junior doctor and FMLM's own Douglas Fellow. Join us as we discover what it takes to put healthcare leadership in action. In many countries, sustainability is becoming more and more of a priority for consumers, voters, and patients, meaning many industries are now re-examining their impact on the environment and reviewing how their practices can play a role in the efforts to safeguard it. Within healthcare, leaders and policymakers are examining the impact of our services on the climate. And in 2020, the NHS became the world's first health service to commit to reaching carbon net zero. We're joined today by two guests who recognise the importance of greener healthcare, Dr. Florence Wedmore and Dr. Hugh Montgomery. Florence is currently working with the BMJ as part of the Chief Sustainability Officer's Clinical Fellow Programme, having completed core medical training, a Master's in Public Health, and spent 2 years delivering educational programmes to healthcare professionals as a Clinical Teaching Fellow. To name but a few of her achievements so far, Florence has established a sustainability network within Barts Health Trust, led elective undergraduate modules on sustainable healthcare, and worked alongside the Centre for Sustainable Healthcare as an external course facilitator. Hugh is Professor of Intensive Care Medicine at University College London, where he also directs the Centre for Human Health and Performance, and practices as an intensive care consultant. He has chaired the last 2 Lancet commissions on human health and climate change, and has written and lectured extensively on the subject. He now co-chairs the International Lancet Countdown on Climate Change, which reports annually. He was appointed London leader by London's Sustainable Development Commission, attended many of the international COP climate negotiations, and created the children's climate education initiative Project Genie. Hugh, interestingly, also holds the world record for underwater piano playing. Hugh and Florence, welcome to the show today. We're really excited to have you both here to discuss leadership and sustainability. But before we cut into that, what kind of host would I be if I didn't first ask the question that I'm sure all of our listeners are dying to know the answer to? Hugh, how do you manage to get into underwater piano playing? Is that something you just pick up, or you just stumble across the skill, or just find a piano on one of your many diving expeditions that you've also done?
Well, just very briefly, medical student. I had a career as a diver before I did medicine and had a commercial diving license, and it was raising money for what was the first portable ultrasound machine in the UK, which was the size of a Ford Fiesta at the time. And it just seemed like a good novelty idea. So yes, anyone wants to try it, don't. It's 110 hours at the bottom of a swimming pool with a synthesizer, it turns out, because clearly an ordinary piano wouldn't work, but they are.
Yeah, I imagine the acoustic setup was not the easy part of that.
No.
Brilliant. And then Florence, so you're early on in your career as a doctor, so it's been within the first 10 years of graduation, but you've already kind of made an initial swing towards sustainability being a key focus of your clinical practice. How did you start getting involved in that?
I think for me, it's quite a gradual thing. I think it's like a sort of slow realization that how much this is related to healthcare and the kind of role of medicine, and starting probably with that realization that, the reason we need to care about climate change, maybe because polar bears in the Arctic, but really, and the reason I care about it is because it already is kind of affecting people's lives and people's abilities to live healthy lives. So I think that was a sort of slow realization as I went through medical school, like bringing together kind of a bit of a, green mindset anyway, and then realizing how much this related to what I was doing in healthcare, and kind of the role of, learning to be a doctor. So it kind of, it came from there, and then kind of gradually realizing also the other side of it, in that like you start to look at healthcare and realize how much that is damaging the environment, and kind of making that like loop. And then you're like, oh, hang on a second, this is really important, and something that we can do something about. And I'm definitely no pioneer at all, but like even in the time that I've been interested in it, like that realization has grown. So, there weren't many people talking about it, or so many people talking about it, 5 years ago. There were definitely some, but it, that's massively grown in the last 5 years.
Back to you, Hugh. So as an expert in the subject, so what do we mean generally when we're talking about sustainability? And then why is it relevant to healthcare and our practice as clinicians?
Well, it's a very good question, because it's one of those words I really don't like, because people use it very badly. And if one more person tells me they're going to be more sustainable, I'll throw them out of a window, because being sustainable is a binary thing. It's like pregnancy. You're either sustainable or you're not sustainable. If something's sustainable, it can carry on indefinitely using the resources that are available to it, which basically means unless you've got unlimited resources, which you might have for something like sun power for a few billion years, then if you've got restricted resources, you have to use them in a circular fashion. So that's if something's sustainable. If it's not sustainable, or if it's more sustainable, it will end up stopping. And in terms of environmental stuff, I guess sustainability could apply to anything at all you're interested in. For my world, it's about climate, carbon, energy supply, but it could relate to the use of rare earth metals, for instance, or all sorts of other things, or indeed water. But I focus very specifically on fossil fuels. And it's worth us just thinking on that thing, what if something's unsustainable, what it means. If it's not sustainable, in this case, that means the energy supply stops, but it also means that human life stops because of the way we're polluting the planet. So the byproducts of being unsustainable are the death of us and our children within the next decade or two.
Yeah, that's a good way of maybe reframing things as well. And I think we've been deliberately inflammatory then in terms of asking you to come and speak on sustainability. And how would you, so then veering away from the term sustainability, how would you reframe that argument in that term? What terms do you think we should be more specifically using rather than that kind of almost buzzword that sustainability has become?
Well, I think we have to be very specific. So I certainly no longer talk about human health impacts. We've done that for years, actually, but Florence has pointed this out, really, talking about the health impacts. The trouble is, if you talk to negotiators in climate, they say, "Oh, that's WHO. It's a soluble problem. Oh, that's doctors do that. Health, yeah, okay, they can change. They can do hospitals. There's a fix for this." This is about human survival, and it's not about survival of future generations. It's about our survival now. If you're under 50, it's about your survival. And if you have children under 50, it's about their survival. So I tend to talk now about human survival, not sustainability. If I'm talking about something being sustainable, we're talking about human civilization and life being sustainable and our ecosystem being sustainable. But I think there needs to be a caveat about what we're talking about in terms of what is the sustainable thing we're discussing, and the timeframes upon which it becomes unsustainable. But I do think the phrase "more sustainable" should be banned, because it's or if someone uses it, they should be absolutely pointed at for this. It's because there is no such thing.
I'm really worried I've said more sustainable already in the intro. Trying to think back of what I've said.
It's not just a minute. Don't worry, I didn't notice.
You mentioned that, focus on survival, and if you're over 50, or sorry, under 50, or if you have kids under 50, this is a matter of future survival. And do you think, this is for both of you, do you think there is a generational divide, therefore, when it comes to focusing on environmental protection and greener initiatives when it comes to that divide? So some people might find that as, oh, well, if I'm over a certain age, then actually this isn't really a problem for me. This is a problem for future generations that I don't need to worry about. Or do you think that actually, in your experience, people on both sides of the generation, do they take that equally seriously?
You go first, Florence, because you are a different generation from me. I'm the old guy here, so carry on.
I think yes and no. I think, yes, there probably does seem to be more awareness in younger people, and definitely when you're teaching medical students, there is a more, they're just a baseline kind of knowledge and awareness is a bit higher. But then actually, I think there's loads of older people who are really frightened by this and see, if they have children and grandchildren, or even if they don't, they care about what's happening. And we're kind of talking about this generationally, but also there's a global divide. There are many people who are already being affected by this and will be affected by it sooner. And so I think sometimes it's easy. I'm not sure I see it, and I think there's lots of older people who are very worried, but have different pressures. And definitely, I was chatting to I sort of heard speaker, a GP in Australia, who started talking about climate change with her patients, and she says actually she's got lots of grandmothers who are having really severe eco anxiety because they're seeing, what the world is going to be like for their grandchildren. So I think yeah, I think maybe it's a divide that we over egg in our heads and often think is more there than it actually is in practice.
Yeah, I mean, I'd chip in. I mean, I think there has been a split. And it's been an interesting one. The older people, well, firstly, both young and old have been very ignorant, because unless you're into this, it's very hard to get the information. When I give lectures, people say, "Where do you get this?" Because actually, if you read The Independent and The Guardian, you might get some of it. If you listen to Radio 4, you might get some of it. If you don't get any of it because it's just not out there. And if you were to look at resources, you wouldn't know where to look. You have to be pretty skilled to get the information. So I think there is a general level of ignorance about certainly the gravity of the threat. Older generations have tended to be quite conservative with a small c. And this is a bit like the division we saw with the Brexit vote, where it was very substantially driven by older people, not by the young. And the problem, of course, is the older people who have decided to a large degree, a lot of them, that this isn't an issue for them, are actually the ones with the fiscal power to make the changes. The youth, we know, certainly in Great Britain, there is a massive amount of eco-anxiety, and it's a problem. The youth are saying, don't keep telling me this. I'm really frightened. You're not telling me what to do. And I don't have the power to make the changes, so please stop scaring me. It's worth saying, too, though, there's a massive difference that Florence has alluded to around the world. I mean, it's well over 60% of youth in the rest of Europe don't believe in climate change. We're living in a slightly eco bubble in UK. We've moved quite radically ahead, but a lot of countries are still a long, long way behind in the old and the young, actually. But it's certainly true. There's a willingness amongst the youth to act, but we've got to find a way of empowering them to act.
Then bringing this back to kind of leadership within healthcare. So the FMLM exists to improve leadership standards across all aspects of healthcare, especially within the UK and beyond, in collaboration with our international partners. How does that translate to how we practice leadership within healthcare in order to bring that greener agenda into the light?
I think that, well, first of all, in the UK and the NHS, I do think we have actually from within Greener NHS, we have and you said in your introduction, that commitment to being net zero carbon. We do have some quite strong leadership there. But I guess within trusts, what does it look like? Well, or within GP practices or other healthcare organisations, I think some of it is just about prioritising it and making it visible what's already happening, so that people are aware. Because I think that there's people sometimes you don't realise how much there is a disconnect between leadership and senior leadership and people working on the ground as you do as a junior doctor or allied health professional or whatever. So I think that there needs to be a bit more of a collaboration there and kind of making visible what's already happening. And then I think there's a kind of a balance between really you need to listen to people on the ground. If you want to make change, there's so much change that they will have a different perspective on. And there's loads of really nice examples of this, of projects where if you just go and ask people, where is the inefficiency in the system? Where are you doing something that's totally mad? And they will tell you. And just bring in another example. I went to a QI talk a few months ago, and there was a project that had been done about syringe pumps for end-of-life care, and they were losing loads, and people weren't getting them when they needed them. So it was a patient kind of safety quality issue. And the person who solved the problem was one of the porters, and he'd been moved to a different part of the hospital, and he just had a viewpoint and was empowered to make that change. So I think that in terms of senior leadership, one thing is to empower people to take the perspective that they have on the really complex system that is healthcare and say, hang on a second, can we do this a little bit differently? But at the same time, I think there also needs to be a bit of a kind of education of what's already happening. So I don't know, when I go give talks in where I worked before, one of the one subject that always comes up is we don't do any recycling. And so I think, there's a bit of an education of, one, recycling is not where we're going to make all the difference. By the time you put something in the bin, most of its carbon footprint's there. And two, what was already happening within the trust. So I think there's a balance between making sure that we hear all perspectives, but also making sure people are aware of the kind of bigger structures of things that are happening already.
The first thing is people need to feel that their actions make a difference. And that's very difficult because you get if I do it, so-and-so won't, or if our trust does it, that trust won't. And if we do it in Britain, what about India? What about China? Everyone just goes, well, what I do doesn't make any difference. And it does. So the interesting part is that it's all about moving the money. Certainly for carbon, for climate change, it's all about moving money. Nothing else matters. Got to move the money. The money moves to low carbon or zero emissions energy sources. Everything is solved. Healthcare is around 11.7% of GDP in the world. So roughly of every $100 spent, 12% of it is being spent directly on direct healthcare. And if you add in things that are consumer health products like Durex and Dettol, which mostly you'd say is, you could be up to probably a quarter of GDP. So if we move that money, the pension funds and hedge funds will move and the problem is solved. And if we do it in the health sector in Great Britain, we change the world because the companies from whom we're procuring are global. So if we change what we do, we can change the entire world. That's the exciting part. What we need to do, as Florence has said, is firstly empower people to get together. So my first piece of advice is always find out who else in your trust is up for it and join up with them, because otherwise you feel a lone voice. And as Florence says, map what other people are doing. The second thing is focus, exactly as Florence has said, on the big ticket stuff. There's no point in putting your energy into small things that are nice, that don't make the difference. So even to give ourselves the smallest chance, and it is still very small, of getting away with this, we need to be decarbonising across everything we do by over 10% per year, every year now. And that's scope 1, which is the emissions that you make yourself in a hospital, for instance, in a combined heat and power plant. Scope 2, which is the power you buy, and scope 3 is everything you procure. That's a massive, massive thing to do. And the big ticket stuff is often the really boring stuff. And if you don't have to do it, as Florence says, go and find people who do, because there are lots of people there who can help you. But it mainly means going to help the Your Trust Board, because they're fighting COVID recovery, 28-day waits for cancer, 4-hour waits in ED. They've got lots of big things to worry about, and they don't know what to do with carbon. And what we need to be doing is dealing with scope 1. We can help them with scope 2, have purchase agreements. We can change contracts, energy use in buildings, patient pathways, do what both of you are interested in public health, which is stop treating people that don't need to be treated or don't benefit from it. In my world of intensive care is absolutely a sinner in that regard. So, but it needs focus, and it needs to be saying, well, to what degree does this contribute to the 10% reduction I need to make this year? And bear in mind, we've only got 7 months of this year left to do that in.
I was just going to come in there. So I think that the hopeful thing that often people may not be aware of, and he's kind of said is, we need to, if we change our supply systems, then the world changes. And actually there is some, I think so exciting work coming out of Greener NHS where they are looking at that. And so they have, because their net zero target includes everything that they have influence over, they have this roadmap where they are going to be having every company that supplies into the NHS will have to also meet those targets. And they've kind of, obviously you can't do it tomorrow because everyone will be like, well, we can't. And if we didn't have anything in the NHS, but they've kind of set up a really ambitious roadmap for that. So I think that that's the kind of hopeful thing that is happening. And, if you have to, it's the power that the NHS has, because it's a single organisation that's unique in the world, really, in terms of the size of that healthcare system. And so that influence is phenomenal.
Yeah, I'd agree with the last bit. The first bit, what worries me is that, we're very good at trumpeting how well the NHS has done in reducing its carbon footprint. And the honest truth is it hasn't. It hasn't done anything. The decarbonisation we can point to is just because the grid energy mix has changed. Nothing else has changed. The big worry is that NHS sustainability will have to move too slow because of its political constraint. That's not a criticism of the team in there, but they are politically constrained. And the changing of contracting currently only applies to things measured in the many, many, many millions of pounds for purchase. So we still need to be driving from the bottom up. We need to be making those changes aggressively and not waiting for other people to do it, partly because we can make changes, but secondly, because we create a permissive environment into which the politicians can move. So I agree with everything Florence has said, but just a flag to say we can't sit back and say, oh, good, they're doing it.
No, totally. And yeah, which is the other thing I wanted to pick up from what you say, which I think is that there's again maybe a tension between doing the thing that matters, that's the biggest, but also doing the thing that you can control. And that's going to depend on where you are. If you're a head of department, then yes, absolutely focus on the thing that that's going to make that big difference. Like look at your nitrous oxide reduction, or your anesthetic gases, or like the really, really big things. If you're a junior doctor and you've got 4 months in a department, collaborate and make sure you're supporting those big things, but also just maybe recognize that you're not going to change everything in a day. And it's, where it's about thinking like, what can I influence as well?
I think that leads on nicely to my next question, which is what are the specific kind of leadership challenges that you encounter when it comes to talking about greener initiatives? I mean, Florence, you've touched on sometimes unrealistic expectations, especially regarding things like recycling. And Hugh, you've touched on actually reframing certain arguments of, making things a lot about, buzzwords and becoming more sustainable in, air quotes. But what are the challenges that you would face in addition to those that you've mentioned already?
Well, I'll jump in quickly and then go back to sort of reverse polarity for a moment. I think for me, it's ignorance, number one. Sometimes that is just genuine lack of knowledge, and sometimes it's willful ignorance, or there's a political lens. And the second isn't disempowerment. Those are the two big things at every single level. So if you talk to even quite intelligent people, they often have absolutely no idea of the gravity of the threat being faced. And that's because the narrative has been controlled by fossil fuel industry and deniers for years, who invented the phrase global warming because it sounds nice and it doesn't sound threatening. And 1.2 degrees doesn't sound very much until you think of the energy it takes to cook an entire planet's surface area by that much, especially when well over 95% of the energy is going to oceans. So there's a lack of understanding of the gravity and the immediacy of the threat. And people are still convinced, as Florence pointed out earlier on, that this is an issue, something to do with polar bears, which it is. But it's also a thing that directly impacts humans because we sit on the top of that ecological pyramid. So I think the first bit is the ignorance. So one thing people can do is learn quickly, really quickly, and then educate people, get them all on the same page. And that can be your colleagues or your trust. And the second is this issue of disempowerment. And that's people doing their 4-month rotation thinking, well, what the hell can I do? Or it's going to the chief executive officer of the trust who goes, I've got a day job that involves all of those other targets. This can't be another one. And that's why you have to get together, get educated, team up, and bring solutions, not problems, to those with whom you work. But Florence, I'm sure you'll have a different perspective. But well, the same one, I don't know.
I do, yeah. It's nice that we don't have exactly the same. I think that there is some apathy, but maybe often there's not as much apathy as we. Again, as you would go if you go into work and you think, oh God, no one else doing this, no one else thinks about it. But I think a lot of it comes from not knowing what they can do, what people can do. And I think that like once you start talking about it, you'll find more allies than you think. The challenges are about like all of, I think you kind of mentioned them earlier, of kind of like time and everything else that's on, like working in healthcare at the moment isn't easy. Like there's so many other pressures. But then there's an opportunity here because actually lots of the things that we can do that are better, reduce our carbon footprint, work towards being truly sustainable, are actually better things that we want to be doing anyway. And there's a nice kind of like, if you think about it, stealing other people's phrases here, Dominic Allwood said this recently, care, cost and carbon. So, often if what you're doing costs less, actually improves people's outcomes, will also reduce carbon. And that might be like Hugh said, making sure that the people who go to intensive care are the people who are going to benefit from intensive care, and we're not putting people through that experience, using all of that carbon and that money and actually making their lives worse because, we could have predicted that intensive care was never going to benefit those people. It might be preventing people getting unwell in the first place. All of these things kind of align. So there is an opportunity there for, and thinking about those arguments, if you're kind of trying to engage people at different levels of seniority, thinking about, actually, if you go to somebody and say, look, I've got this great thing I want to do, and I want to do it because I care about the planet or polar bears, because we're still talking about that, then maybe you'll turn people off. But if you go to your chief exec and you'll be like, well, I've got this great initiative and I'm going to save you loads of money, then you're much more likely to get people on board. And almost actually, I think the other thing is that like action begets action. So if you can go and do something and show a win, then you're much more likely to get people on board than kind of saying like, oh, this is a problem over and over again without giving those solutions.
Yeah, I think you both touched on a really kind of key point that a lot of our listeners will probably be asking themselves as well, is that for those who aren't already converted and aware of the fact that, this is a crisis of, existential level threat, working within healthcare at the moment is really, really challenging. And Hugh, you've touched on, a lot of the different other competing priorities that a lot of leaders will have. I mean, elective recovery times, A&E waits, ambulance times. These are the things that, politicians always have in their sound bites, because these are the things that they focus on immediately. Obviously, we're starting to see the environmental awareness rise up within voter priorities and amongst clinicians. But there must be a degree of almost, it's out of sight, out of mind. This is a delayed outcome for a lot of people, or a slow burn, and compared to the immediate reality of all the challenges that healthcare staff are facing, how do we make sure that we're keeping that within that central focus, so that people aren't just putting that to the back of their minds?
Well, it's very hard, isn't it? Because humans are very badly wired for things that are immediately pleasurable, that cause even short-term risk or medium or long-term risk. So unprotected sex, alcohol, cigarettes, drugs, all great fun at the time, but they were associated with consequences. And humans aren't very good at wiring those two things together. And it's the same reason people develop a breast lump or a lump in the neck and then don't turn up for months and months and months until it's become very painful, or it's become visible, or for some other reason, by which time it can be too late. And this is a difficult one, because this is a situation we're in at the moment. I've been told for the last 25 years, people start taking action when they see how bad it's getting. Well, number one, by the time it's getting really bad, it's almost certainly too late. And secondly, we are seeing that right now. We've had years now of escalating and progressive severe extreme weather events across the world: fires, floods, famines. And people are still going, my word, look at that. That's hot. And we're still framing it incorrectly. Even the Met Office at Christmas was saying, we've got to recognize this is the new normal. It's not the new normal at all. This is a staging post on the way to much, much worse catastrophe. So we need to treat this a bit like the first signs of a cancer, and stop ingesting the poison, stop smoking, and then treat it. We've got to do it quickly, because otherwise we can have metastatic disease and it's all over. And that's the situation we're in right now.
I really appreciate Hugh's point, and I think that yeah, I mean, and I had a real moment, having thought about this for a long time, a couple of years ago, when I wasn't working there at the time, but one of the hospitals in my trust flooded in the middle of summer because of kind of very extreme rainfall. And that really was like, whoa. And this was something, I've been talking, there's a report that says, hospitals in London are going to be increased flood risk. And then I was like, hang on a second, this is happening now. And so that kind of emotional connection moment really hit me then. But I think there's still it's very difficult. You kind of need this stuff to be normalized and to be doing it anyway, because I think there's very few people who can have the kind of emotional capacity to every day think, I need to do this because it's a crisis. I need to do this because it's a crisis. And maybe sometimes what we need to do is to kind of, just set us down that path and, make it kind of normal, so that you don't have to constantly engage being like, I need to do this because it's a crisis. But then at the same time, I don't know, because then at some point you kind of let your, maybe you relax a little bit, because you're like, okay, well, I'm doing my bit. And so that's the kind of apathy that we need to get away from, being somebody had a really good word for it, I can't think of it now, but that kind of tick box, I've done my thing now, which I think that's my kind of take on that is yes, we need to engage with the problem, but also maybe sometimes we could just get on with the solutions. And especially when those solutions are, saving money, improving care, reducing health inequalities, and leave it, if there are people who can't engage every second of the day with the problem, I don't know. I feel like I've once again said something quite different from you.
No, so, and I think one of the things is measure it. And because if you don't measure it, you can't change it. And it's like this 10.2%. I mean, every year it's been getting worse. If we'd acted 15 years ago, you'd be on a sort of 5% a year trajectory. A couple of years ago, we were on 8.2% a year trajectory. Because we're not doing anything, and because our emissions are still rising, we're now well over 10%. And it's probably a lot more than that. So you need to measure it, and you need to be saying, where are we together on reaching that 10% this year? Where are we on that journey? Because if we're lagging, we need to double our efforts to get there, which is why for individual actions, the use of the carbon calculators online works well, because you're able to do it every few months and go, have I managed to reduce my carbon emissions yet further? Oh, no, I haven't. What can I do next? So we need the metrics. And we need to work to the goal, because otherwise we fall into that trap that we talked about earlier on, being more stable. I'm doing my bit. I'm recycling from theatres. I've reduced, our use of nitrous. Or I've done X or Y. Well, that's great, but you've done that and you stopped, and we're still not 10% down. So what else do we do?
So then, what would you both like to see from leaders and emerging leaders at each other's end of the spectrum? So Florence, you're a junior doctor, an emerging leader kind of within this space. And Hugh, you've got a wealth of experience and, over 20 years of working within the climate health space. And from established leaders, what would you like to see the next generation of clinicians coming through to really adopt, and the one thing that you really want them to get? And then Florence, what do you want to see from people who have gone before and have started to kind of forge that path already? What support or practices do you want to see them adopt, and in all generally to facilitate that cross-generational engagement with the issue that is climate health?
Essentially, we're at a time now we need to unite. So this shouldn't be what do the old crusties like me do and what do the youth do. And we've got far, far, far too much fragmentation. When we started this journey years ago, no one was doing anything to do with health. We produced the first organisations, actually at the BMJ, the Climate and Health Council. Now there are a plethora of them everywhere, and everyone's got some green formula of some sort, and everyone's doing a bit of something in some sort of way. And we can't do this anymore. We can't afford to have this defrayed broad wave, because it won't have impact. We need to be working together now, exactly as Florence said it on, share the knowledge we've got of what makes a difference, make sure we all do the same things. If we're all laser focused on one target, well, there'll be a series of them, but we can burn through it really quickly. But we can't do it if we're broad. So for instance, Scope 2, we've got to get zero carbon power into all the hospitals. Well, we ought to be pushing our trust to do that. So they can all move to Octopus Energy or Good Energy, but actually we can get them to club together to get power purchase agreements. That's new to ground installation of solar and wind. Makes a big difference long term. It moves money at scale, but that means gluing together trusts that are too busy to even have thought about it. So let's get together, find out who'll be up for it, do the heavy lifting for them, create the plan, the business plan, create the contracts for them, and make it easy to do. Food. We need to be local, seasonal, vegetable based. Does every trust need to have someone like a Florence saying, this is what we need to do? It's really, really healthy. It's very, very good for you. It can potentially save money for the trust if we do it on side. It creates local employment, lots of advantages. Does a Florence in every trust have to do it on their own? Crazy. Let's get people together to come up with one recipe for how it's done, and then say together these 12 trusts can all jump together and make this difference. Same with procurement. If we're going to say by 2025, we are going to demand a 50% reduction in greenhouse gas emissions by 2030 from everyone from whom we procure. Florence's trust and mine on their own can't possibly do that, because we haven't got the buying power. We get 30 trusts in area to do it, and we absolutely have got the buying power. And furthermore, another 30 will join. So that would be my bit. I think we unify across generations and across sectors and across geographies and across disciplines and with companies, because a lot of companies want to do it, and we unite and we empower ourselves together. That's what I would be saying. But Florence, your call.
No, I really agree. I think that the kind of fragmentation, and it's great that there's so many people, but almost it makes it hard to know what's going on, and that's just an emerging space like this. That's a kind of almost, I guess, a necessary step, or a kind of, but now we need to start kind of like really learning from each other and making sure that we've got kind of good platforms for kind of for sharing knowledge. And I'm going to just do a little shout out for the BMJ in that we are kind of putting together some of that, those the things that relate to the clinical changes. They've already got a net zero clinical specialty series, and in the autumn we'll be having some kind of more of those sort of tangible actions that people can take. But to go back to your question about what we want from leaders, I think that this isn't dividing. We need to kind of all engage at all different levels, and to show that engagement as well. I think that and take it seriously, not the kind of lip service greenwashing, like we've done our bit stuff, but like to really take it seriously. And I think listen to people from all different perspectives, because I think in terms of like what we do within, like, yes, the stuff that happens at the kind of top levels, that's like purchasing things, energy providers, all of that stuff. But then there's also stuff like within the system where we could be making the system better. And I think there just needs to be more opportunities for people with that, like a really different perspective, different like viewpoint that a chief exec is never going to see about how the system works. And I think there needs to be, space for that. And then the other thing that I'd ask is for just give people time to do this. Like, we have kind of recognized roles for medical education where you can spend a couple of days a week teaching alongside your clinical work or research or whatever, but we need, like, there's so many gains if we did the same for this kind of environmental work, and you would find the gains in money, improved care, but also actually you empower people and you'll get people more engaged in working. We have the workforce crisis that kind of endlessly talked about. Like, this is so many people really care about this, and it's a way of re-engaging them with loving working in healthcare again. And so that, I feel like I keep doing a kind of positive reframe, but there was a real opportunity there.
No, I think that's great. I think this whole conversation has been really chock full of not just what sometimes talking about climate health can descend into, of just kind of this fear of the fact that, all this is happening and there's nothing we can do about it. But actually both of you have really been really great at giving lots of practical things that people in health systems, regardless of their seniority, regardless of their clinical background, can do to engage their teams, engage their environment and their communities and the communities of practice around them, to engage in these things and to make sure that they're not just thinking, oh, this is happening, but it's someone else's problem to act or someone else's responsibility in Westminster. But actually, this is something that I, as someone working in a health system, have a responsibility and, importantly, an ability to influence. It's been wonderful having you both on Healthcare Leadership in Action this week. I think our listeners will have gained a huge amount of insight into that, not just the staying away from the term "be more sustainable," but generally, reframing this as an issue that isn't just something that affects every other industry, but actually is something really kind of pertinent to healthcare and the way that we deliver healthcare. This is a crisis that we as a species need to address, that if left unchecked can develop and will develop into something that is, of an existential level priority. And having chatted to both of you and seen what the initiatives that you've already started, Florence, in your career, and the things that you've been involved with all the way through, Hugh, I'm not still, as I said earlier, I'm not really sure when you find time to sleep, but it makes me feel a lot better that, there are people who are managing to cut through all of the noise and translate that into practicable action within the NHS and other health systems.
Lovely. Thank you for having us.
Thank you.
Thanks for joining us today on Healthcare Leadership in Action. Remember to subscribe wherever you get your podcast from. And if you want to learn more about what we're doing at the Faculty of Medical Leadership and Management, sign up for our newsletter at fmlm.ac.uk/sign up. Thanks for listening. We'll see you next time on Healthcare Leadership in Action.